good morning, or whatever time it is where you are right now. I need you to stop and listen very carefully because what I'm about to tell you goes against almost everything you've been told about managing pain and discomfort as you get older. The medical establishment has had a default answer for decades. When something hurts, when a procedure comes up, when you're facing a difficult recovery, the answer has almost always been heavy anesthesia, strong opioid painkillers, and aggressive pharmaceutical intervention. And I am here today to tell you that for seniors, that approach may actually be doing more harm than good. My name is Dr. William Lee, and I've spent the better part of 3 decades studying how the human body, specifically the aging body, responds to medical intervention. And what I've found, along with dozens of research teams around the world, is quietly revolutionary. A landmark study published by the Journal of the American Geriatric Society followed over 4,200 patients aged 65 and above and found that seniors who underwent general anesthesia had a 41% higher risk of developing postoperative cognitive dysfunction. That's a medical term for what many families recognize as sudden, alarming mental fog or confusion that can last weeks, months, or even become permanent. 41%. That is not a small number. That is someone's grandmother, someone's father, maybe you. But here's the part they don't put in the brochure. There are soft, science-backed alternatives that work extraordinarily well for aging bodies, and today I'm counting down the 5 most powerful ones, from least to most impactful. And I'll warn you right now, the number one solution on this list surprises almost everyone who hears it. Most people assume it's some expensive supplement or a complicated therapy. It isn't. It's something so simple that you might have dismissed it 100 times already. Before we dive in, I want to ask you something personally. Leave a comment below telling me your age and whether you or someone you love has ever had a bad reaction to anesthesia or heavy pain medication. I read every single comment on this channel, everyone, and your answer helps me make better content for this community. Now let's get into it. Number 5 on our countdown is something I call thermal regulation therapy, though you may know it better as the strategic use of heat and cold on the body. Now, before you think this sounds too simple to matter, I want you to hear me out because the science here is genuinely impressive. Researchers at the University of Michigan's Department of Physical Medicine conducted a series of trials involving 312 patients over the age of 68 who were preparing for or recovering from minor surgical procedures. The patients who received a structured protocol of alternating warm compress application and brief cold therapy reported a 38% reduction in perceived pain scores and required 52% less pharmaceutical pain intervention during their recovery period compared to the control group. Here is why this works so powerfully for aging bodies specifically. As we get older, and I'm speaking now especially to those of you over 70, the small blood vessels near the surface of your skin become less efficient at regulating temperature and circulation. Think of your circulatory system like a highway system for healing. In a younger body, that highway is 4 lanes, wide open, moving fast. In an older body, construction has narrowed it down to 2 lanes. What heat does is expand those vessels, widen the highway, flood the damaged or tense area with oxygen-rich blood and natural anti-inflammatory compounds your own body produces. Cold, applied briefly afterward, acts like a signal that triggers what scientists call a vascular pump effect, essentially squeezing waste products and inflammatory markers out of the tissue. The practical application is straightforward. For pre-procedure anxiety and muscle tension, apply a warm compress, not hot warm, around 104 degrees Fahrenheit, to the affected area for 15 to 20 minutes, 3 times daily. For post-procedure recovery or chronic joint discomfort, follow 20 minutes of warmth with 5 minutes of a cool, not ice-cold pack. Always place a thin cloth between any compress and your skin, and if you have circulation issues or diabetic neuropathy, consult your physician before beginning this protocol. The synergy tip here is this. Pair thermal therapy with gentle diaphragmatic breathing, slow deep belly breaths during the warm application phase. Studies show this combination activates the parasympathetic nervous system, your body's natural calm and heal mode, and can amplify the pain-reducing effect by an additional 20 to 25%. Coming up at number 4, we're moving inside the body to something you can actually eat that acts almost like a natural anesthetic from the inside out. Number 4 is curcumin, the active compound found in turmeric. And I want to be very precise here because most people are consuming it completely wrong. A clinical trial conducted at UCLA's Longevity Center and published in the American Journal of Geriatric Psychiatry found that older adults who took a specific bioavailable form of curcumin twice daily experienced a 28% reduction in inflammatory markers in the blood and reported significantly lower pain levels compared to placebo. But here is the critical detail. Standard turmeric powder from your spice cabinet has roughly 2 to 3% curcumin content, and your aging digestive system absorbs only a fraction of even that. This matters enormously because of something called inflammaging, a term coined by Italian researcher Claudio Franceschi that describes the chronic, low-grade inflammation that silently accelerates in our bodies after around age 60. Think of inflammaging like a campfire that never fully goes out inside your joints, your blood vessels, your brain. It's not roaring, so you don't always feel it acutely, but it is constantly consuming resources and damaging tissue. Curcumin, when properly absorbed, acts like a targeted bucket of water. It specifically suppresses NF-κB, which is the molecular switch that turns inflammation on. The reason this matters for anesthesia alternatives is significant. Much of the acute pain that drives doctors toward heavy intervention is sitting on top of this chronic inflammatory foundation. Address the foundation, and the acute spikes become far more manageable. To actually absorb meaningful amounts of curcumin, you need one of three things. A supplement specifically labeled as featuring enhanced bioavailability. Look for products containing phosphatidylcholine, piperine, or nano-curcumin formulations, or you cook your turmeric in a healthy fat like olive oil or coconut oil before consuming it. The dose used in most successful senior trials has been between 500 and 1,000 mg of bioavailable curcumin daily, split into 2 doses. Take it with your largest meal of the day. The synergy here is extraordinary. Pair curcumin with omega-3 fatty acids, either from fatty fish 3 times a week or a high-quality fish oil supplement, and research from the University of Pittsburgh suggests the 2 compounds work on separate but complementary inflammatory pathways, creating what scientists describe as an additive anti-inflammatory effect. References to the studies I'm citing today are linked in the description below. Now, before we get to number 3, which begins to cross into territory that even many physicians don't fully appreciate, I want to pause and say something directly to you. If you're finding this information valuable, please hit that like button right now. It takes 2 seconds, and it tells the algorithm to share this with more seniors who genuinely need it. And if you haven't subscribed yet, please do. I release new videos every week focused entirely on evidence-based health strategies for people 60 and above. We are building something real here. Now, number three is vagus nerve stimulation. And I know that sounds like something from a science fiction novel, so let me translate it immediately into plain language. The vagus nerve is the longest nerve in your body. It runs from your brainstem all the way down through your chest and into your abdomen, touching your heart, your lungs, your digestive system. Think of it like a superhighway of communication between your brain and the rest of your body. And here is what researchers at the Feinstein Institutes for Medical Research discovered that is nothing short of remarkable. Deliberate, non-invasive stimulation of this nerve activates what they call the inflammatory reflex, a neurological pathway that can reduce systemic inflammatory signaling by up to 50% in some patients. That is the kind of number that makes pharmaceutical companies uncomfortable. For aging bodies, this is particularly significant because after age 75, your body loses approximately 35% of its vagal tone, meaning the nerve becomes less active, less effective at keeping inflammation in check, and less capable of facilitating the rapid recovery that younger bodies experience almost automatically. This decline correlates directly with increased sensitivity to pain, slower wound healing, and a greater need for pharmaceutical support during recovery. Restoring vagal tone is therefore not merely about comfort. It is about giving your body back one of its most fundamental self-regulating systems. The technique I want to share with you is called slow-paced breathing with extended exhalation, and it is one of the most robustly studied non-invasive vagal stimulators available. Here's the protocol. Inhale slowly through your nose for 4 counts, hold for 2 counts, and exhale through your mouth or nose for 8 full counts. That extended exhale is the key. It is specifically the long out breath that activates the vagus nerve. Practice this for 10 minutes twice daily, ideally once in the morning before eating and once in the evening. Patients in a Heidelberg University study who maintained this practice for 8 consecutive weeks showed measurable improvements in heart rate variability, which is the gold standard biomarker for vagal tone, and reported that their pre-procedure anxiety dropped by an average of 44%. I have a patient, I'll call her Dorothy, 74 years old from Tucson, Arizona, who came to me absolutely terrified before a planned knee replacement. Her previous experience with general anesthesia had left her confused and disoriented for nearly 6 weeks, and she was dreading going through it again. We implemented a vagal toning protocol 3 weeks before her procedure, combined with the curcumin strategy I just described, and her surgical team was able to use a regional nerve block instead of full general anesthesia. Her recovery was dramatically different. She was walking assisted within 18 hours. Her pain scores were consistently 3 to 4 points lower than the clinical average for her procedure. She called me 2 weeks later from her garden. The synergy tip for vagal stimulation, cold water on the face, specifically a brief 10 to 15 second immersion of your face in cool water, is one of the fastest triggers for vagal activation known to science. Use it as a reset before any stressful procedure or moment of acute pain. Now, number 2 is going to challenge everything you think you know about the word sedation. Number 2 is what I call microdosing melatonin as a pre-procedural anxiolytic, and let me decode that word immediately. Anxiolytic simply means anxiety reducing. Melatonin as a sleep supplement, and a surprisingly modest one at that. But researchers at the University of Copenhagen conducted a randomized controlled trial involving 158 surgical patients over the age of 65 and found that a low dose of melatonin administered 90 minutes before a procedure reduced preoperative anxiety by 36%, reduced the required dose of intraoperative sedation by an average of 29%, and perhaps most remarkably, patients in the melatonin group showed significantly lower rates of postoperative delirium. That last finding is the one that made me pay very close attention. Postoperative delirium is a serious and underreported crisis in senior healthcare. It affects an estimated 50% of surgical patients over the age of 80, and its consequences are not trivial. It is associated with accelerated cognitive decline, longer hospital stays, and increased one-year mortality. The reason melatonin helps so profoundly is twofold. First, the aging brain is exquisitely sensitive to the neurochemical disruption caused by anesthetic agents. Think of it like a finely tuned old clock that gets jarred loose by heavy sedation. Melatonin, being a naturally occurring compound that your own pineal gland produces, speaks the brain's language. It doesn't override normal neurological function, it gently guides it. Second, melatonin has significant antioxidant properties, and new research suggests it actually protects neuronal mitochondria, the energy-producing structures inside your brain cells, from the oxidative stress that anesthetic agents can trigger. The dosage finding here is important and slightly counterintuitive. More is not better. The studies showing the greatest benefit use doses between 0.5 and 3 mg, far below the 10 mg doses many people take casually. After age 65, your melatonin receptors actually become more sensitive, not less, and high doses can paradoxically disrupt the very receptor function you're trying to support. Discuss this strategy openly with your physician or anesthesiologist before any upcoming procedure. The synergy tip: pair melatonin with a small amount of tart cherry juice, one of the few whole foods that contains natural melatonin and precursors, consumed alongside the supplement to extend its action window by approximately 45 minutes, according to research from Louisiana State University. And now, the one you've been waiting for. Number 1 on our countdown. The most powerful, most scientifically supported, most consistently underutilized tool for reducing seniors' dependence on heavy anesthesia and pharmaceutical pain management. Are you ready? It is purposeful movement, specifically a structured prehabilitation and post-rehabilitation walking protocol, combined with targeted resistance exercise adapted for aging bodies. I told you it would surprise you. Not a pill, not a procedure, movement. Here is what the evidence actually says, and I need you to sit with these numbers. A study from the University of Southern California involving 891 adults aged 65 to 82 found that patients who engaged in a structured 6-week pre-surgical exercise program, walking 20 to 30 minutes daily at a moderate pace, combined with twice-weekly light resistance training using body weight or resistance bands, required 44% less anesthesia during their procedures, had 58% fewer post-operative complications, and returned to baseline functional independence an average of 19 days faster than sedentary patients. 19 days faster. Think about what that means for someone's life. The science behind this is connected to one of the most important concepts in senior health, mitochondrial density. After age 60, sedentary adults lose approximately 1% of their skeletal muscle mitochondria every year. Mitochondria are your cell's power plants, the structures that generate the energy needed for tissue repair, immune response, and neurological recovery. When you exercise, even moderately, you signal your cells to create more mitochondria. More mitochondria means more energy available when your body faces the extraordinary demand of surgical recovery. Exercise also directly counteracts sarcopenia, the age-related loss of muscle mass that affects 30% of adults over 70. And this matters for anesthesia because leaner, stronger bodies metabolize sedative drugs faster and more cleanly. There is less tissue for these compounds to linger in, and the hepatic enzymes, the liver's cleaning crew, are more active in exercising bodies. I want to tell you about a gentleman I'll call Robert, 79 years old, from Portland, Oregon. Robert came to me 18 months before a scheduled major abdominal surgery. He was sedentary, carrying about 40 extra pounds, and deeply worried. His cardiologist had already flagged him as high risk for anesthesia complications. We began slowly, 10 minutes of walking twice daily, then 15 gradually building. We added simple chair-based resistance exercises 3 times a week. By the time Robert went into surgery, his preoperative assessments had improved so significantly that his surgical team upgraded his risk category from high to moderate. He received a lighter regional anesthesia protocol rather than full general anesthesia. He was home in 3 days, walking the block outside his house on day 5. His wife told me he cried when he made it to the end of the street. Movement gave Robert that. The practical protocol I recommend for seniors considering an upcoming procedure is what I call the 6-week prehab blueprint. Begin with 10 to 15 minutes of walking daily at a comfortable pace. You should be able to talk but feel mildly breathless. Increase by 5 minutes every 5 days as tolerated. Add 2 sessions weekly of seated or standing resistance work. Wall push-ups, chair squats, resistance band rows. For seniors over 75 or those with joint limitations, water walking in a pool is equally effective and dramatically reduces joint stress. The synergy tip here ties everything together. Combine your movement protocol with protein timing, consuming 25 to 35 grams of high-quality protein within 45 minutes of your exercise session, directly combats anabolic resistance, which is the age-related blunting of your muscles' ability to respond to exercise. Without adequate protein in that window, older bodies simply cannot capitalize on the stimulus that movement provides. Greek yogurt, eggs, a quality protein shake, or a palm-sized serving of salmon, these are your allies. I want to close with something that goes beyond the science because the numbers and studies are important, but they are not the real reason I made this video. The real reason is this. Too many seniors are surrendering their health outcomes to default protocols that were not designed with aging bodies in mind. You are not a standard patient. Your brain, your liver, your cardiovascular system, your muscles, they respond to interventions differently at 70 than they did at 40. And the beautiful, empowering truth is that gentle, thoughtful, evidence-based strategies tailored specifically to your physiology can give you something that no amount of heavy sedation ever could: agency. The ability to enter a procedure with a body that is prepared to emerge from it with a brain that is clear, and to walk, literally walk towards your own recovery on your own terms. It is never too late to begin. The research says so. Robert and Dorothy said so, and I believe it for every single person watching this video right now. If this gave you something today, a new idea, a feeling of hope, a practical strategy you'll actually use, please subscribe to this channel and hit the bell so you never miss a new video. And now I want to hear from you. Leave a comment below telling me which of these 5 strategies you're going to try first, and whether there's a specific health challenge you'd like me to address in a future video. Your comments shape what I make next. I'll see you in the next one.